the team of doctors, nurses, therapists, and care managers that care for stroke patients.
Today, we're going to talk about some of the most important things you need to know about stroke.
Doctor, what is a stroke?
A stroke occurs when a blood vessel in the brain gets blocked off or bursts. The brain cells don't get enough oxygen, and that part of the brain starts to die and stops working.
There are two main types of stroke, ischemic stroke and hemorrhagic stroke. In an ischemic stroke, a blood vessel in the brain gets blocked off by a blood clot or a plaque. This is an example of what happens in an ischemic stroke.
In a hemorrhagic stroke, a blood vessel in the brain bursts and there is bleeding inside of the brain. This is an example of a hemorrhagic stroke.
How would I know if I'm having a stroke?
If you think someone may be having a stroke, look at their face and ask them to smile. If one side of the face is drooping, it could be a stroke. Then ask them to lift up both arms. If one arm isn't moving as well as the other, it could be a stroke. Then listen to their speech. If they are having difficulty speaking or slurred speech, it could be a stroke. If you see any of these symptoms, it is time to act fast and call 911 immediately.
We have the best chance of helping you reverse your stroke symptoms if you call 911 and get to the hospital immediately. Sudden loss of vision, sudden severe headache, sudden numbness on one side of the body, or sudden loss of balance that could also be symptoms of a stroke. If you've experienced any of these, call 911.
What increases my chances of having a stroke?
There are many different factors that can lead to a stroke. The major cause of both types of stroke is high blood pressure, which is also called hypertension. Diabetes, high cholesterol, smoking, and an irregular heartbeat called atrial fibrillation can also increase your chances of having a stroke. During your hospital stay, your stroke team has been working to understand what caused your stroke. We want to do everything possible to prevent you from having another stroke.
Doctor, how can I prevent a stroke?
Controlling your blood pressure is the most important thing you can do to prevent both an ischemic and a hemorrhagic stroke.
Check your blood pressure regularly at home or at your local pharmacy.
When you leave the hospital, you will most likely be prescribed new medications. Make sure you fill your prescriptions and take your medications every day.
If you have trouble remembering to take your medications, use a pill box, set an alarm, or ask a family member to help you.
How do I get better after a stroke?
During your hospital stay, you are evaluated by a rehabilitation team, including physical therapists, occupational therapists, and speech therapists.
Many stroke patients will need these therapies during and after their hospital stay to get stronger and more independent.
What happens after I leave the hospital?
It is important for you to follow up with your primary care doctor and a stroke neurologist after you leave the hospital. At your stroke neurology follow-up visit, your doctor can address your concerns, check your medications, and help support you in your recovery. Feeling down or depressed can happen after a stroke. If this happens to you, tell your doctor so they can help you in the recovery process. We look forward to seeing many of you in our stroke neurology clinic, which is located across the street at 6410 Fannin Street on the 10th floor.
As you prepare to leave the hospital setting, we encourage you to return back to attend our stroke support group. Our stroke support group allows patients and their caregivers the opportunity to share their story and to continue to learn during the stroke recovery process. For any additional information, please feel free to contact your nurse or grab a flyer from the nurse's station.
Thank you for watching this educational video. We hope that it has helped you to understand stroke better.
Thank you for the opportunity to take care of you. Please let us know how we're doing.
If you have any questions, you can ask anyone from your stroke care team.